Hi, this is Kathy Philbin from Select Women's Healthcare here in West Palm Beach, Florida. And I wanted to go over what to expect at your first new OB appointment. It's sort of a little daunting, I'm sure, and you just found out you're pregnant, and it's very exciting, but it's not as bad as you think. We'd like you to get to the appointment about 15 minutes early because, of course, with everything, there's always paperwork before we can really get down to it. So you fill out a lot of information in regards to, your insurance and your, where you live, and we want you to bring your insurance card and your ID. So that's pretty basic. And then we also would like you to arrive when you're about 6 to 8 weeks pregnant. That's like the ideal time to start the whole process off. So we can actually do an ultrasound at 6 weeks so we can determine where this pregnancy is, which we would like it to be in the uterus, but it is a little frightening. But there are times when pregnancies don't present exactly the way you would think they would go. So that first appointment is very important, and I think, even though you think, well, what could go wrong, but it's important to, if we catch things early, then we might, head it off at the pass before it gets to be, more like a dinosaur. So anyways, when you finished your paperwork, we usually have you go to the bathroom. You're gonna give us a urine sample, then you weigh yourself, and that unfortunately is just going to keep going up that's part of the process. And then we have you come into the, actually we don't sit you down in an office setting, in my office we go into the exam room and we just first keep all your clothes on and we just talk. Okay, we kind of get to know each other and just get a feel for what you want to do during this time period, like in regards to your plan for what you had hoped for and, dreamed of for like your delivery situation. So we kind of go over that, and we have to kind of go into like just determining also how far along pregnant you are. So you should also come with your last menstrual period, like the first day of the last menstrual period. If you could know that helps a lot in trying to determine how far along you are. And then we'll go over your past pregnancies, or if this is the first one, which is always fun and exciting, then, we're starting from a clean slate. But if, we want to know if you had a previous C-section or how those past deliveries, how they went, if there were any complications, how big the babies were, when you delivered. So we're just trying to figure out, for the future, if there's something we should be looking out for, okay? And so then after we kind of go through your pregnancy history, then we go into your own medical history. So that section is just going through all these questions in regards to, have you ever been diagnosed with diabetes or high blood pressure or problems with your heart or problems with your thyroid? It's just generally a whole slew of questions, like your gastrointestinal system. We're just going through all the different areas of the body. And that's not, unless you have an extensive history, it shouldn't take too long. And then after that, we talk about your own family history. So it's first we start off with the mom's family history, like the woman that's pregnant, and we go over also the same, because sometimes history repeats itself. So we want to know if there's something that we should be on the lookout for in the future. So we ask again about diabetes in the family, and do you have any cardiac issues or any thyroid issues, or is there anybody who's had stroke or abnormal bleeding history. So all of that is super important. And then we finally get to flip to the next page, where finally we kind of go into the mom's family genetic history and also the dad. We include the father of the baby's genetic history. So there is an important role for the father also. And it's nice if he's there, because then, he can just right there tell us everything too that he is aware of. And sometimes you're not aware, and then once you tell family that you are expecting, and you might hear, after you hear all the things that we're gonna go through, and hopefully some of the verbiage is a little daunting. You may not know all the terminology, but that's actually a good thing that you don't know the terminology, because then that probably will mean that it's not in your family. But you could go home and you could ask your mom, and you could ask grandma, like, hey, did anybody in our family have cystic fibrosis or any of those types of diseases that can be passed to a newborn? So we go through that, and then we go through more of an infectious disease questionnaire, where we're trying to figure out if you were recently exposed to any kind of infection. Now the big thing is the COVID virus, and so we want to know if you've had an infection, or prolonged cough, or have you been traveling outside of the United States. Well, we know during this COVID problem we're not traveling anymore, but we used to ask that in regards to the Zika virus. So there's a pretty long, kind of extensive list of questions that we go through. And then after that, we have the physical exam portion of the new OB visit. So this is almost similar to like if you've had an annual exam, or if when you're a little kid and you go to the pediatrician, except you also will have a vaginal exam. And hopefully no pediatrician has done that to you. But anyways, so it's pretty simplistic. We're going to take your blood pressure. We're going to listen to your heart, your lungs. We're going to I listen to the carotid arteries to make sure that there's no blockage or bruise, and that the blood's flowing through the brain properly. Then we listen to your lung sounds. We tap on your back to see if we can hear, feel like you have any pain. So it might be an indication of a kidney infection or kidney stones. And then we lay you down, and we actually feel for your liver, your spleen, and we're feeling also from the outside where the uterus is. And so we feel also where your ovaries are, and we ask you if you're having any tenderness in that area. So depending on how far a person is pregnant, it also will be indicative of how large the uterus is. So that kind of helps us too to see with our exam if it's measuring up to what you thought your last menstrual period was. And so then after that we do a pap smear, and we get gonorrhea and chlamydia also is obtained through the pap, and we send that all off to the lab. And I usually then let you guys get dressed, because I feel like, the shortest amount of time where you're feeling vulnerable is better. And then once you're dressed, then we draw your blood. So blood draws for pregnancy, in the initial blood draw, it's approximately 5 vials. It's really not that much. It seems bigger than it, actually is, but it's really under like 30 cc's of blood, but it can be also a little, scary for some people. So, we try to make it short, sweet, get it over with, and then you don't have to have your blood drawn it depends on you. Like if you want to have genetic screening, if you're like 6 weeks, you'd have it done at the next visit in 4 weeks, or if you're closer to 8 weeks, it would be 2 weeks. And we can also test for like the possibility that you could have, a baby with Down syndrome or trisomy 21, 18, 13, and any aneuploidy for like the sex chromosomes. So that also can indicate if you're having a boy or a girl. So there's like kind of a scary side to it, but then there's kind of this little bonus reward with that test as well. So a lot of people are excited about the fact that they can have like the results of the baby's fetal sex. Now they can detect that through the blood at 10 weeks. So then you can do a reveal if you want to. All right, so then after all of that, we go through a little bit of education. We give you a little pamphlet we made up about the pregnancy do's and don'ts, and we go through that with you. And then, if you have any specific questions, then we'll go over that as well. We make sure you're on a prenatal vitamin, and we want to make sure that it also includes DHA in it for helping with the brain development. And then we make your appointment either like 2 weeks to 4 weeks, and then we keep going on every 4 weeks until you are 28 weeks pregnant, and then every 2 weeks until you get to the 36-week appointment, and then once a week until you are ready to deliver. So I hope this has helped and maybe taken away a little bit of the fear that you might have in regards to having your first new OB appointment. Take care.